Well, the COVAX facility was formed to simply avail vaccines for countries in Africa, countries in South Asia, countries in Latin America. Of course, some countries in Latin America have vaccinated their populations, like Chile has done very well in this regard. But African countries are going to fall behind. Of course, the pandemic hasn't had a very serious effect on Africa. If you see the amount of infected people, the amount of people dying out of the virus is very small relative to other Western countries which have been really decimated by this virus. Economically also, the impact has been very, very small in Africa. Of course, the long term, we'll see what's going to happen. The predictions are bad, but the short term is that much of the African population is a farming population, and therefore farming has not been disrupted the way factories have been disrupted in China, the United States, and Europe. So the idea is, although Africa could withstand the virus much better than the other parts of the world, we need to look into a possibility of getting COVAX to be more effective and to appeal to the international community, especially the rich countries, so that they would avail these vaccines to the vulnerable people in the South. When we say the South, we mean Africa, Latin America, and South Asia. The interesting thing is this vaccine production has been paid up to pharmaceutical companies and research institutions by governments. The US government, the European governments, all of them have paid for them to develop these vaccines. So there is no way that the pharmaceutical giants can claim that these vaccines are owned by these pharmaceutical giants, and I don't think they will have the moral high ground to be able to negotiate prices for their vaccines with third world countries. Since the development of these vaccines has been financed by governments, governments should have the key decision-making agency in this process. But what we see today is, although governments paid for the research and development of these vaccines, the same governments are trying to buy it from the same pharmaceutical companies. And I think this is the story we've passed before with HIV/AIDS, where giant pharmaceutical companies refuse to provide the drugs for HIV/AIDS, survival drugs at cost. And then eventually when I was in the UN, we had to negotiate with the pharmaceutical companies to provide generic versions of the drugs to Indian pharmaceutical companies to produce them. So eventually, of course, Indian companies are going to produce it, Chinese companies are going to produce it. Of course, China is producing it already, and other countries are going to produce it, and therefore it might come very cheap. But the way now pharmaceutical companies are asking for, and specifically, if you take, for example, the Pfizer vaccine, which is a very complicated vaccine that requires deep cooling, which is not available in Africa. So the Johnson & Johnson one may be more palatable because it doesn't need the kind of logistics nightmare you would go through bringing Pfizer vaccines here. So overall, I think once these vaccines are available, there is big hope for Africa to survive this pandemic. It has survived it already, but it will be in a better position to do this once the vaccines arrive here.
In this regard, also COVID-19 vaccines.
Well, you see, as I said earlier, China has promised to make these vaccines a public good. And I think any vaccine available today, either through COVAX or purchased from Western pharmaceutical companies or through direct support from China, would be a welcome opportunity. One thing is very clear, the Moderna and Pfizer vaccines, which are now developed using what you call the messenger ribonucleic acid, mRNA, holds a lot of promise for other diseases too. We have problems with Ebola, for example, which has resurfaced again in Africa. We have HIV/AIDS. So this kind of virus and flu virus are going to be with us for a long period of time to come. They're part of nature, and therefore the scientific advance is very important. And this will also allow countries like China, which have progressed so much in industrial development, to produce more and more versions of different vaccines to help Africa. And Africa and China, Africa, I think, is a major trade partner to China now. Well, China is a major trade partner to Africa. And at the same time, China has developed deep relationships with African states. And therefore, I think the Chinese government would be in a position, given the potential for China to produce as many vaccines as necessary that Africa needs, I think we can rely on China very much. As I said earlier, the WHO Director General is saying that this vaccine problem that we have within the Western countries is not acceptable. He said it actually is a moral failure of humanity. And therefore, I'm sure China will step into this and then provide the vaccines necessary to save human lives in this continent. The second thing is this will give also additional impetus for African countries to develop their health systems, health research, and health facility capacity to be able to produce such vaccines here in Africa. At least if we have 2 or 3 countries producing it, now with the advent of the African continental free trade area, there will be an option for African countries to exchange medical medicines, vaccines, and other products that are needed by different countries, but produced in a few countries in the continent. South Africa might lead the way in this. Other countries like Ethiopia can also lead, especially where they are developing industrial parks. But the scientific community in Africa has to think twice, not to simply wait for other countries to develop vaccines and medicines, but also here in Africa, our scientists should be able to develop the kind of vaccines and medicines that are necessary to treat human beings.